My Doctor, your health anytime, anywhere. Hello, lovely people. Welcome to the My Doctor podcast. My name is Joy Mwesigwa, and I am your host. And on this podcast, we talk about health. We want you to be able to live a healthy life, to be in charge of your health, to be comfortable with your body in all ways. So we talk about health, different illnesses, signs and symptoms. We also talk about all the other aspects of health, like health law, telemedicine. And today we're going to be talking about something like that. So I'm here with the founder of My Doctor, and I'll give him a chance to introduce himself. You're welcome, Mr. Innocent.
Hi, Madam President.
How are you?
And hi, everyone that is watching. How are you doing?
I'm okay. I forgot to tell you guys, my name is Mwesigwa Joy, a.k.a. Madam President. anyway, could you introduce yourself to our viewers?
My name is Innocent Kawooya. Nowadays, I like reminding people that I'm a national independence medalist. So it is not for any bragging. It is for gratitude, being thankful to God. And I'm very excited to be hosted home. Like I told you in our past episodes, it's very exciting to come home, and you're welcome. Yeah. And I'm very happy to also come and share my views and opinions about healthcare, things we've been very, very interested in dealing with for a long time of our life, probably for the last 30 decades. 30 years. 30
decades.
Maybe my grandfather was very interested. My great-great-grandfather maybe was a witch doctor. You might never know, but I'm very interested in discussing things to do with public health, community healthcare, and the likes. And I'm happy to be hosted by the one and only Madam President.
Thank you so much for coming back to our show. So let's start with talking about what telemedicine is in a short period of time, because it's going to encompass most of the video, right? So we want our people to understand what is telemedicine.
Yeah, thank you, Madam President. Well, I'm not so good at always making definitions of things, because I always want to have a holistic view of how I understand something. But telemedicine, from a telephone conversation point of view, relates with using tele-driven technology. ITU, which is the International Telecommunications Union, and probably the world is governed of telecommunication around, relates a lot with conversation to do with telemedicine, because like I told you sometime, and like it is written in history, that telemedicine started somewhere at an airport some years ago in Germany. And telemedicine today relates with a lot of provision of service and access to professionals, healthcare professionals, bridging the gap for patients and healthcare professionals using tele-driven services and mobile devices for that matter nowadays. But in the context of My Doctor, I would like to define telemedicine as a simplified approach of ensuring we have everyone, every Ugandan, every African have access to a professional caregiver, a professional doctor, or a clinician, or whichever it is, and have access to them by using the simplest means, either using SMS, sending an SMS and asking and getting a response, either calling or beeping and then get to be called back, either using a WhatsApp call, a video call, a WhatsApp text, a Telegram, and the likes. All also using the content that we disseminate using telephones, and being able to access that information and use the advisories we share and the prevention of methods that we share with different experts to learn something and prevent dying soon.
Yes. Okay. So far, what services have you been able to offer in terms of telemedicine at My Doctor?
Well, the services that I know and you are part of the provision of the services are vast. But one of the very exciting things for myself, and probably for the other stakeholders that were part of this vision in the early days, like around 2009, is the fact that we've been able to enable more than 40,000 people have access to a doctor by calling and being answered for free. I mean things like antimicrobial resistance that are fast growing, and statistics say that, for example, in the next 5 years, and microbial resistance will be responsible for death of more than 10 million people every year if there is no approaches, community-based approaches to combat this challenge. Why? Probably more than 92% of people who buy medicine in pharmacies actually never see a clinician, a nurse, a doctor to get a prescription. Rather, when I feel like I have a headache, I walk to a pharmacy and buy medicine. One of the people I actually saw for a long time is my father, always buying paracetamol, and I was one of the people he used to send to buy it for many times. So, and I now look back, I don't know whether I still text them because I've not stayed in his home since when I was 16 years, but I don't know whether he still takes paracetamol. But I imagine and I always thank God for keeping him, because we were told that it was going to be very bad for people who actually take medicine without prescription. But then I've seen it in very many other places. And the commonality of the act is that it becomes a practice that is approved by everyone, that it is not a problem by non-practitioners. Even doctors themselves can ignore being diagnosed, and then they walk to a pharmacy because there is not so much policies that stop us from just walking into a pharmacy. Because it's different when you go to Europe, when you go to America, when you go to Asia. Many countries have set up policies that do not easily allow someone to walk into a pharmacy and get medicine. And now in our space, it is I have my 1K, I have my 5K, I need to buy paracetamol, I need to buy
Another one is
magnesium,
amoxicillin. That one
amoxicillin.
is really abused.
Yeah,
And
amoxicillin.
like a small cough.
Yeah.
When every day I need medicine.
Exactly. And the next thing is we are seeing people suffering things they don't know. And to make matters worse, this practice is also happening in animals. For people who take care of so many animals, cows and the likes, they also tend to become vets by themselves. They self-medicate their animals, and then this transits through animals and people because we eat animals. Like you've seen that joke of the only professionals that eat their customers. You've seen that joke. Yeah. The vets boasting and saying we are the only professionals that eat our customers. So now all of us who are secondary consumers of the products of veterinary services also end up eating meat from cows, from goats, and any other, and then also end up suffering from the same outcomes, which are very dangerous outcomes of misuse of antibiotics and the likes. So when we are talking about telemedicine today, we are holistically looking at it as My Doctor in ways of one, creating the most important awareness for people to prevent acts like antimicrobial resistance, to prevent self-treatment, self-diagnosis. I mean, even if you are a witch doctor, you're not qualified to diagnose a single disease unless you've proven. You've seen churches that have doctors in the church, and when you go there and you're saying you're sick, they first ask doctors to check you. I mean, that practice should be a thing for all of us. So, as
Those
My Doctor,
churches, where? In Uganda?
yeah. There's,
Hey.
I would mention one, but I've seen the same practice at, I've heard because I've not been there, but I've seen Pastor Apostle, I don't know, called a pastor or Apostle Kakande, synagogue. I've seen that happening. Actually, one of our doctors at My Doctor, I'm sure you know Dr. Nathan actually, has been supporting in the space. Actually, that's how I get to know that they have professionals that actually check people. When you come and say, I have a pain here and there, they're like, okay, how? Where? So be diagnosed so that when people are praying for you, they know what they're praying for. So unlike any other practices that actually go against all those kind of procedures, and which becomes the majority of all of us. I've been a victim myself of misuse of drugs. I've been saying when I feel a pain, I have a pharmacy. There's a time and there when I had a moving pharmacy in my bag. I could have vitamin C.
But then now, since the good thing is you've done self-medication before, I would want to know why? Like, why did you resort to self-prescription, yet you can go to the hospital? Like, as a person, genuinely, why?
Well, as a person, I used to do self-medication because I didn't have quick access to a doctor. You see, the things to do with access and convenience also matter a lot. And My Doctor as a conversation, as an initiative now comes in very handy. saying, just like our slogan, "My doctor, your health, anytime, anywhere." I don't have to be lining up and begging doctors like they are God. I cannot imagine myself.
No, you don't be begging
No, as in that. That's
doctors.
how sometimes they treat us.
Anyway, yeah, and the lines
Unfortunately,
are crazy
they are
sometimes in the
crazy. Yeah,
hospital.
you go and wait. My colleague recently had something that had to be diagnosed, and they told him come to the hospital at 7, one of the major hospitals in the country. And this person that told him is a major specialist that people respect a lot. He was there by 7, and then he was worked on at 3. He hadn't eaten anything, yet he has issues with ulcers. I found it very disrespectful as a person. I'm like, how about if you schedule and tell people the right time when you'll be available, so they only come then? Because the same person has to fend for his family. He has to take care of himself, and so when you talk telemedicine, you are thinking of creating a convenient way of helping people solve their healthcare problems while they still continue with their lifestyle, with their jobs and the likes. So, if someone is not used to walking to a doctor, if someone thinks it is a very private issue and they need to talk to someone who can't see them, like people who say they are very shy, how are you helping them actually have even the easiest secondary access to a professional? At least to give them a hint. Of course, as we speak telemedicine today, you know for the fact that we are going beyond having a human interaction, but we are also developing digitized solutions that are leveraging artificial intelligence, like the My Doctor Chatbot. It is typically being built to make sure it leverages AI to support on primary challenges of people. If I have a symptom, if I have a pain somewhere, probably we have been able to feed our chatbot with enough information to help you point on a number of things, to help you point on a specialized hospital, a clinic, a professional that actually can help you understand. Like it is already said that a problem, once well known, is 90% solved. So there are many chances that if somebody is sick and they want to know a doctor, then they should be able to know who exactly they should know, where they can find them and the likes. I mean, we've been having those discussions of the challenge. They're called pre-what? The women
Preeclampsia.
preeclampsia, and how I heard about that way before my late auntie died, who was one time a midwife, and then it took me another almost 20 years without ever hearing that word anywhere else. Yet it is a recurring problem among women and it is very common. But then see how digitization bridges that gap very easily, because someone has seen Madam President running a very fast growing and very interactive and useful podcast. They really want to interact with you and share this information because they also want to make sure more people know about these challenges. So what and how would we ever know about it if we're not making sure healthcare is a part of the entertainment, the information, the education we find in the digital space? But back to your question, yes, I used to self-prescribe. Why? Because many times I couldn't access a doctor very easily. You cannot find a phone you can call like a My Doctor number. You can, when you call a hospital like Mulago, you talk to public relations. None of them is a doctor. I mean, many things like that. And you're like, okay, what's the problem? So, like, I remember always buying Serestamine, but then that wasn't self-medication because it had been described by a senior doctor telling you that when you're having this kind of effect, then you should buy this medicine. But then there are many other things. For instance, people get so fatigued nowadays. You know about Wellman, you know those medicine, well woman and the likes. And depending on how good your pocket is, many people now make it a lifestyle that every time when they are very tired, because they think it is, thank God it's a Friday, they go home and buy well man, well woman, and then they take it all their life. Yet those who actually manufacture the medicine, they say shouldn't be taken all the time. Should be taken only and when there is need or when there is prescription. So people like me who actually work for more than 14 hours every day might end up in the same spaces buying and self-medicating, but I'm not one of them anymore. I am born again in
You're
that.
born again.
Yeah.
Actually, I during that preeclampsia period when we
Yeah.
went to Sega Market, I think you saw it. So I met a lady and she didn't have, she wasn't pregnant, so she didn't have any issue with what we're talking about. And then but she was like, but I need to talk to you about another issue. that I will not say because of confidentiality. But then she had been self-medicating for 10 years. And I asked her, why? Like, I told her, Mulago is free. Chirudu is free. We have free hospitals, health center, 4s, 3s. We have ever talked about this year. And she was like, the lines, she was like, the access, the lines are crazy. She told me that she went to Mulago one time and she needed to do a scan and all that stuff. Meanwhile, she didn't even see a doctor. Her daughter Googled and told her that what you have, the pain you have in your abdomen needs a scan. So she didn't see any doctor for history. She just went straight. She wanted a scan. And she told me she spent 3 days at Mulago before that scan came out. And I was like, okay. And then she had the scan, but she did not see a doctor. I didn't even understand the entire thing, yeah? And I talked to him like, you know what? This cannot be handled here because it's long. But however, let me give you a number you can text on WhatsApp. Then she's like, I can't use WhatsApp. I'm like, okay, you can call the number and get free consultation. And she was like, are you sure? Are you sure I can get? She was so happy because she was telling me how, and there were like ladies, you know how market is, eh? There were like ladies around and they're like, Manange, lines are so many. And like, they were even trying to ask us things other than preeclampsia, which shows like the access gap is still like big. Yeah. And so solutions like this, telemedicine, are things that can help our mothers, help us, help the people around us to have great access. So now also that brings me to a question, because now this lady didn't know how to use WhatsApp. Her smartphone was bought by the daughter and she has not yet learned how to use it. So how best can we help such people to benefit from telemedicine services? Rural people in rural areas, or people who are not well conversant with the internet and with social media and with even WhatsApp, which should be at least the bare minimum. How best can they be helped in terms of telemedicine?
Thank you, Madam President. I want to first take you back before I ask. I also have a question. Has the lady been helped?
Yeah.
Did you follow
She got
up?
in touch. Yeah.
She got in touch with my doctor?
Yes, she
Have they given her a solution?
She's there. She's still, but she will, you know how like sometimes there's some traditional beliefs that come in.
Yeah.
But we're handling how well.
Okay, please. Okay, good. You're handling. She's in able hands. But we should make sure we see that through and see how she gets fully helped. That should be a very good case for people around her. But also importantly, like you asked, I mean, when we envisaged telemedicine in the early days, we were thinking for a woman like that one, who now for her, she's been lucky she has a smartphone, so she can get someone in the neighborhood and then they use it. Yeah. But we are thinking of one who will never access a smartphone, but then needs the best and simplest advisory localized to their context. Understanding that someone is coming in a place where there is a lot of beliefs related to witchcraft, for example, and then you need to help them understand that your problem is not witchcraft related. You need a doctor. And then connecting a cycle of professionals and places that actually are specialized providing the same service, because it's not going to end at the conversation. But that's where you say call a doctor, and anytime, anywhere you are, just call the number. I mean, you've seen, we've had this discussion has been a part of the conversation. I always disagree with the fact that we first frontline a conversation of internet connected delivery of service. No, internet is going to be. Statistics of Google that I read yesterday showed, like, for example, YouTube in 2023 was visited 98 billion times using mobile phones, as opposed to using desktops, who are just 8 billion. Can you imagine? And those statistics are very informative of the fact. Now, mobile extends us to the fact that most people are using these services using mobile devices. So after that, which kind of mobile devices are they using? In Uganda alone, we always say the latest statistics from UCC say about 7.8 million people have smartphones. But the same statistics say more than 28 million people have phones. So if only 7.8 million people of 28 have smartphones, then it means 21 million people actually don't have them. So what does that mean? It means for whatever we're going to be innovating, we are going to think of technology that actually first serves the bigger number. The bigger number is people who are able to dial At least people now know how to send mobile money, people know how to receive money, people know how to call. And as part of the interventions, My Doctor, HiPipo, Comesa, and all the partners we work with are going down, even with the Ministry of ICT and National Guidance. We are deliberately promoting initiatives that are training people to use basic technology, introductory courses through HiPipo University that we're taking to villages and helping people understand, do what we call TOTs, trainings of trainers, train chairwomen, train women leaders, train mothers, key leaders in communities, teach them about how they can use their phones to access healthcare services, agricultural advisory, and all the likes. And in the sense, helping creating an accelerated approach to quality healthcare. When that is done, we are having a very good conversation with an organization from the UK, for example. And we've also had collaboration with Gifted, and all of this is geared around saying, can we sensitize people? Through HiPipo University, we've done the healthcare entrepreneurship course, and you know that even when you're training doctors, you understand that there is a big gap. Digitalization is not a thing that everyone has been well acquainted with yet. You'll find a nurse who cannot even type using a notepad, yet they have a smartphone. They're able to write on a paper, but they have to scan and send you. You see now, all that is clear signs that there is still a huge gap in creating capacity building and education that actually not a one size fits all, but is customized for making sure everybody that needs the education. Now, the thing we're going to do over the years is making sure if we are doing medicine, if we're doing healthcare, we're going to tailor make courses that are simplified for the person who knows nothing. Imagine a person who was born in 1921 and still living and has never had a phone but needs assistance. So how do we do that? Telemedicine might extend to even having community phones, to having, booths that are accessible, that someone can find a booth somewhere and then they call directly to a doctor. We are thinking of such things. But also telemedicine might also be enabled and supported by things like mobile hospitals, so that you show people that on the day when it is really badly off, a hospital has ever come to you. So it shouldn't be very hard for you to walk to Mulago, yeah? And when all that is happening, you are thinking, we have all these very many problems. The problems we have in Africa related with healthcare are current problems. The problems that people in Europe have are future problems because they have already created solutions for the most immediate challenges. Even COVID had interventions a certain way, but of course a vaccine had to be created for quicker solving of the problem and for managing for the future, and also for ensuring that it is a preventative way of making sure people are safe. So you want to look at telemedicine, look at that kind of woman that has been self-medicating for 10 years, and then you give her that very quick solution and you see how excited she is. Say, there is a solution you can reach out to, you can get a doctor and talk to them for free, you can get advisory. And then you might have to take another 3 months helping them appreciate that this is actually real and it's going to work for them. Otherwise, people die like that. Like I was saying earlier, that antimicrobial resistance now grows over time, that have been eating meat of cows that have been treated badly because they misuse and antibiotics. Yeah? And then I have also been self-medicating for very many years. So one day I get a problem that no doctor can solve. Or one day I get a problem that no medicine can be used to solve. Why? Because I have used every antibiotic that the world can ever provide. So my body cannot be treated by any. You know of the levels of treatment that sometimes when someone has a challenge, no matter how dangerous it is, the first medicine that is used on anyone is the simplest medicine. But the moment the body is not reacting, then we are going to get the big syringes and pierce people with big stuff. Why? Because they are not reacting to the medicine. Maybe because their bodies have for long used medicine that they didn't need. And some have to be flashed, like a flashing what? Yeah, I would say nothing. Yeah, yeah.
Okay, so that's interesting. How,
Yeah.
how people are learning something. So I would want us to talk about social determinants of health, because most times people think health is only when you get sick that you are unhealthy. But so how best can, what are social determinants of health, and how best can telemedicine
Yeah.
touch that too? Yeah.
Thank you, Madam President. So, social determinants of health, we had Dr. What was his name? Doctor from Ethiopia.
Oh,
Yeah,
Dr. Yakub
yeah, Dr.
Hashim.
Yakub. Isn't he from Ethiopia? Yeah, Yakub.
Hi, Dr. Yakub.
Had Dr. Yakub. So we had Dr. Yakub, who should be specialized talking specifically about social health. But then I am happy to discuss the things we found, data driven and data backed up findings from my doctor. And then the vision of building a healthcare network for everyone. I mean, from day one, we were saying that my doctor should become a social network for healthcare, a Facebook. Instagram is no longer like the real social network that we had. You guys, the Gen Zs and Gen Alphas don't know what social networking was. HiPipo by that time was probably one of the most beautiful social networks you'd find. MySpace, High Five, Facebook was real. A lot of Lugambo could happen off the space. Now what we have is really show off. It's what we have to show every day. So we only broadcast ourselves. But those days, you could go inbox and then type 1,000 messages in one day. I remember a colleague of ours who could sit in Makerere University for the whole day without having a meal. And then he's typing and sending to girls messages from all around the world. I will not mention his name today, but I have all the rights to mention him because I'm saying facts. So we were thinking, can we create a community of like-minded people? Bring caregivers, bring doctors, government, patients in one place. And then, depending on the things I want to do, the things I like, depending on the challenges I have, I can meet like-minded people, challenged people on the platform and help them understand or help myself understand how they are managing and how I can also best manage my own challenges. And social health in that sense would mean we are able to bring together people and help them understand from each other, share experiences, as opposed to having to physically only look for people you will never find. Because I know of a colleague who usually has to do a transfusion, and the transfusion of bone marrows that he does, the only person who matches his stays in Brazil. But you don't know how long it took them to find that person. Like he always had a lot of pain, and we could also feel it from a distance. Like you could be seated somewhere and say, "Oh my God." You find someone, the veins are swelling, the eyes are paining, he's having a very bad headache. He almost wants to knock his head on the wall until when the head bursts. So his transfusion is first of all very expensive. Secondly, they have to look for somebody. That donor of his has to come from very far away, like from the other side of the world. Of course, the people in Europe call all of us the global south, all of us in sub-Saharan Africa, and all of those people in South America, all in the global south. But someone has to come from that side. But I always asked him, and I still ask him that, are you sure there is no other person who has your match? But then there is no patient records around Africa. There's no record. Even yours as a doctor, you might not find them anywhere. So we don't have very easy ways of finding information that can actually solve problems of many people. So when you have an intentional approach to having telemedicine, helping bridging the data and information gap of patients and keeping records of people in a very safe way for a long time, it means that one day we might be able to dig up to solutions that many people have been looking for a long time. Because maybe in Nairobi, there's someone who has the same blood group, the same type of marrows that he needs, but because there is no information in Kenya. So the question is saying, social health is saying, we are going to solve these problems by understanding that other people have the same challenges, they are solving them this way. But also we are going to solve them by finding easy means of having information to things that solve our problems. You know, when it comes to matching of blood groups and the likes. So if you asked us in this studio, how many of us know our blood group? How many of us can find it somewhere very easily? You'll ask George here, he doesn't know. Then you ask him, find out Zauja's blood group. He doesn't know. Yeah, you'll ask Norton, he doesn't know. Do you know McLean's blood group? You know, I don't know all my children's blood group. So I will be having a problem. You ask me, do you have Camilla's blood group? I don't know. I don't know yours, Joy. Like we always here conversating, and then, so what if you have a problem one day? What if I have one and no one is even able to save? But of course, it's not supposed to be a thing that everyone should be knowing off their head. But at least I can say that I know secondarily that I can find it on a platform. That if I ask my doctor and there is a prescription, there is an order that actually needs to be served a certain way, we can find the information somewhere. It is not anywhere. So how do you solve such problems? That is how telemedicine solves problems. It is easy for us. We are thinking that one of these days, in the next 5 years, we should build the most robust and the most information rich telemedicine service across the world, where we are able to integrate with solutions from Europe. And no, if I need a donor from Europe, if one needs from here, it's very easy to find out. All you need is to go through the KYC requirement for you knowing if someone is a doctor in the UK and they're looking for someone to match with in Uganda. It makes it very easy. And now, like you've seen when you go to community clinics, now those problems are crazy in other places where people don't have these fancy studios of ours. Those problems are crazy where people only buy data of 500 shillings once in a month to check and see if anyone sent them a message. They are crazier. But then imagine the person who is in a place where there is not even no internet access. What happens to them? So meaning they will never call. You see, when we have problems with like NIRA here, our national identities, that every time when I need to get a new one, I need to register on paper again. So now imagine for a patient. So someone has collapsed. How are they going to tell you that they're the ones?
They're the ones. And also sometimes you can't know what the previous issue someone had. I think I talked to you about a story of the lady who was from the US and she was a judge. She came back when she was now old, chance to rest in Uganda, what. And then she falls sick. She gets a stroke. She cannot speak. Now, I don't know what medicine they injected her with, but she was allergic to it. Now there were no details because there's no way they could connect to the healthcare system in the US. There was no track record of her data, no patient history, nothing. All they have, because even her children who are in the US did not know the medicine. You get the ones who are here are seeing her like for the okay, they have not lived with her for that long. So they injected her with a medicine. She's reacting. Remember, she has a stroke. She cannot speak. She cannot tell you what she's going through. All they're seeing are the vitals, like the blood pressure and everything going down. She's getting high. Like, just a doctor just had to assume and be like, could be anaphylaxis, could be an allergic reaction. And like they gave an antidote. So that shows that in Uganda, even now, first of all, our patients in Uganda see very many doctors in very many hospitals. So there's no even connectivity in the hospitals themselves. So if I go to, let me say, Mulago today, and then maybe what they tell me, I don't want to hear it. It's okay. It's okay to seek second opinion, though it's not bad. Yeah. I'm like, I need second opinion. I go maybe to the My Doctor clinic in Nasana. I'm like, no, I think they're all wrong. I go to maybe case. Now, there's no connectivity. So in the event that I reach maybe the My Doctor get and I faint, they know nothing about what happened unless there's a referral note, but still. So I understand with the data system in Africa, in Uganda, is really, really lacking. Unless maybe someone has been like a diligent patient of that hospital and it has a good data collection system, but still you start from, if I go to a hospital now at 20, I won't say my age, maybe at 23,
at
they 21. Will start from there.
Yeah.
They don't know what happened to me when I was 5 years. Yeah. They don't know that I had an accident. Yeah. And maybe you get, So I really understand. So as we wrap up the episode, what does the future look like for you if telemedicine is in the picture?
Well, the future looks healthier, more informed and aware of their challenges. For instance, initiatives like Connected Care, which is the initial idea of My Doctor from day one, connecting smaller players, clinics, village health professionals, they're called VHTs, nurses and the likes, putting them into one space and helping them have resources to information, storage, record keeping, and the likes would help. For instance, the road to Wakiso up to Masindi, Hoima, we are going to make sure that the first trail of connected care covers every one of the clinics and hospitals and enable all of them have free access to a telemedicine platform where they can all safely keep records for free. So it means that anyone 3 years from now who would work on any of the hospitals, any clinics, they can easily find their information in an app as long as the person accessing the information is certified to get it. They should be doctors, they should be nurses, they should be members that are subscribed members of the connected care community. Healthcare looks like that for me. Healthcare in the next 3 years looks like having been able to run probably more than 1,000 community clinics in different places around the country and maybe around the continent. I mean, being able, if we are treating about 300 people in every community clinic, so imagine having served more than 1.5 million people in different community clinics and helping all of them have access to a tool, to a number they can call whenever they have a challenge free of charge, and also helping in creating a digital healthcare community of people who subscribe for easy access to professionals, to consultants, and the likes. And that is the future that I envisage. But I also believe that through the initiative like our My Doctor podcast, we should be able to have reached probably more than 300 million people with information with these podcasts. They are not very exclusive in having all the information, or they're not all covering that they have everything that someone should have, but then they have important hints that connect to the information that people should know or people must know to lead healthier lives. And as we think of contributing to building a healthier life, of course, God above everything, you envisage seeing like the community you've created from My Doctor, that has professional dentists, surgeons, and the likes. We envisage seeing probably thousands of professionals like that on the network. And like I've told you about Dr. Lino and the other people and our branch in German, and one that we're also going to start in the UK for My Doctor. We think we are going to have an easier exchange of professional knowledge. We are going to see very many affordable devices that support and accelerate efforts in health, digital health, telemedicine, and likes being here and being usable. But we are also going to see initiatives like we're talking about initiative like Walk Hour, which is not walk to work, the political conversation, that we are going to see ourselves celebrate very many people being healthier. You remember when we were in the community clinics in Kawempe, and one of the most emerging challenges was related to hypertension, pressure, and the likes, because even people in the most vulnerable communities also don't work out. They don't work. Someone wakes up, they have a small shop somewhere, they sit there, and then they're working for their survival. They're looking for their next $2, $3 to buy food at home. So no day in the year do they find a single saving to go and see a doctor. And guess what happens? They also walk to a drug shop and buy medicine. Children walk through the same things. So I envisage a world where, of course, this conversation will continue over the time, but I envisage a world where we should be able to have people have very equitable access to healthcare. Child, young, old, male, female, youth, anybody being able to access healthcare and at a very affordable rate. From a My Doctor perspective, I see a future where someone who can subscribe with $3 for a year can access almost any professional for consultation throughout the year by just subscribing $3, which would mean about 1,000 shillings every month. And then I see us having very highly premium services for those who want exclusivity, having very easy convenience for accessing the professionals that can only be found in Mulago, for example, in referrals. You see, when you have a heart issue, no matter how rich you are, you are going to go to the Heart Institute, which is only in Mulago. But then sometimes you just need to have access to a professional and have information, because you might be having a heartbreak and you're calling it a heart issue. And
I remember we had a podcast called the Taksubo syndrome.
yeah. So you might be having a heartbreak. Someone is checking you, and then you're telling people, I think I have
physical pain.
I have a hole in my heart and the likes. So how do we ensure that we use telemedicine to actually bridge that gap? And for me, that is what I see us solving in the long run. I mean, the near future.
Thank you so much for this episode. I think we'll have you another time because I feel like there's so much we've been talked about. But thank you so much. So maybe you can give like closing remarks to the people before we end the episode. Yeah.
So to everyone that is watching around the world, first of all, thank you, Madam President, and thank you for the great work you do. And then our entire leadership at My Doctor, our CEO, Bridget, and everyone. And then to the entire community that you put in together. And for everyone that is watching, healthcare is a human right for everyone. It has been stated by the UN, and God said it clearly, that we should always lead healthier lives. But also, most importantly, I'll tell everyone that is watching that the most important doctor you will ever find is God. So as you look for My Doctor, trying to seek for technical, medical advice and healthcare advice, take it to yourself and pray to God and believe in God and ask Him for wellness. But also ensure that you take care of your body. Do not use things that are going to get you sick. Eat good food when you can. Take water. Sleep enough when you can. Walk at least for 20 minutes every day. Even when I don't do it every day, but at least I exercise. And that's why I keep in shape all the time. But at least make sure you also do. And I've also seen a fast rise of challenges coming out of ulcers, what they call ulcers. And then I've also found out that they are very preventable. Things like eggs are very affordable on the market. Make sure you have a meal and in time so that you don't have to be solving problems that you would have solved every day of your lives. Yeah.
Thank you so much for your time. Thank you so much for coming to the show. To our viewers, hope you've learned something about telemedicine. It's a very broad topic. And also, there's no reason you should be self-medicating because of lack of access, or there's no reason you should have an emergency at home and you have no one to call. I understand you may not have a family member who's a doctor or what, but that's why telemedicine is here, for you to be able to reach a doctor from anywhere, anytime, using your phone, whether calling or using the WhatsApp or using our website. And My Doctor is here for you. So the number's down there. If you ever have an issue, please feel free to reach out for free consultation, or put in a message. As you type the message, to go to the point. Don't be like, hello doctor, just hello doctor, my name is this and this, I have this problem, it started when I give all the history, and you will be helped, because telemedicine is here to make our life easier. And also, as you've heard, we have a lot in store for you. We're very excited, where you can talk to AI about your health issues, and we are feeding it with the correct information, current information. And you can, if you don't want to talk directly to a doctor, you can use the AI chatbot. We want you to have all the options that you can use to be able to receive help. Thank you so much. Thank you for watching this episode. This is the My Doctor podcast. My Doctor, your health anytime, anywhere.
My Doctor, your health anytime, anywhere.